Hello everyone, so in this chapter we will have a look at what is current in inclusive education and rare diseases and what is the reality inside of the classrooms, as well as real stories of students, of families and teachers. So the schooling of children and young people with rare diseases is affected and interrupted in many cases by different factors. Almost all people with rare diseases encounter the same difficulties in the delay and failure in the diagnostic and the information and orientation towards competent professionals, access to quality health care and social benefits, and poor coordination of hospital and external care. So also, as we saw in previous modules, they present reduced autonomy and difficulty in integration in the school, in work, in social and in family environment. Many rare diseases involve physical, mental, sensory and motor disabilities. So all this has consequences at the educational level when it comes to assessing the students and identifying the specific educational needs that they have. So that is why education must be governed by the principles of normalization and inclusion. This requires, on the one hand, viewing children with a rare disease as holistically through a multidisciplinary lens, and on the other hand, training education providers in legislation and the development of rare diseases policies and intervention in schools. So schools should be places where we see the holistic development of the students and we promote it, but also where the professionals and personal development of teacher is promoted. So Gainza conducted a study on the educational inclusion of students with spina bifida disease, and in it we see some highlights that are interesting, like in the educational setting. It is important to give a voice to people that are involved. Thus, for example, a family, when we involve them, we see this linked to improved learning and academic performance by students. So in addition, it also has an impact at the social and emotional level of the students, and it is a very important key to successful inclusion in schools. Likewise, it is very important that the same students also could participate in making decisions in the educational context. If we give them a voice, we not only foster their involvement in their own learning, but based on the experiences and perceptions that they have, teachers could develop good practices for them. So some of their areas for improvement in the school we could say are in accessibility, transitions time between schooling stages, personal attitude, educational responses, and coordinated work. Finally, it is worth mentioning that the responsibility of educational needs should not fall only on the teachers or the school. Joint work is very necessary, not only by professionals in the educational context, but also between professionals from different contexts, the educational, the medical, and the social, and between the school and the families.